And we are at the Meadville Medical Center, and joining us is Dr. Maan. Dr. Maan, thanks for joining us.
Thank you. Thanks for inviting me.
We're going to be talking a lot about kidney health, but before we get into that, tell us about yourself.
Well, I'm a practicing nephrologist here in Meadville Medical Center, and I have been here for almost about six years now.
Wow.
Yes. I was trained, I did my med school back in India, and then I came to US in 2013. I did my residency and fellowship both at Allegheny General Hospital in Pittsburgh. And after that, I came here, and I've been here since then, and I love it.
Talk about growing up in India.
It's a very different growing experience than compared to here. Like childhood was a lot focused on, you have to get a lot on academics, which is really good, which is what got me here. But I wanted to play more. I'm playing more now, so I'm catching up with all that.
That's great.
Stuff.
Oh, and we'll learn about what you're playing over here. At what point did you know you wanted to be a doctor?
Ooh, that's a tough one. Well, in India, so the focus is so much on academics, and the system is like you have to kind of very early in your career have to make a decision. The decision is usually not made by you. It just kind of what your grades are, what your parents want to be, and all that stuff. So you kind of get diverted. So I got diverted into this field. Thankfully, the more I kept, like during med school and then after residency, and my interest peaked when I started doing the nephrology fellowship. And that's the most beautiful thing, like because as I'm going to be practicing as a nephrologist, and eventually my path got led to by different ways, and when I started doing it, I'm like, this is great. This is what I want to do. So I love it. So I'm the lucky one. It was not intentional. I can't really say I wanted to be a doctor all the time. No, I wanted to be a nephrologist. No, it just happened, but it happened very good.
Just out of curiosity, if it wasn't that path, was there another path?
I think I would have wanted to be a teacher. Yeah, I like to teach, and once again, same thing. I like to teach, and this field also provides me the opportunity to do that as well. So good or bad, I don't know, but but I do like to teach, and it's another passion of mine. So I think if not a doctor, I would have been a teacher.
So it sounds like people. You're interested in people, in helping in some capacity.
Yeah, and same thing comes with same thing with the patient education. So I'm like, as doctors, like, yes, we do prescribe medications and all that stuff, but I think the major role of healthcare should also involve patient education, and that's why, once again, these are kind of a good platforms to talk about these things, and we do try to spend as much time as possible to teach the patients as well. So same thing goes in that. Same way, yeah.
Yeah. So teach us about nephrology, and what was it about nephrology that you said, I think this is my interest, this is what I want to pursue?
Yeah, so a couple of things. One was, and this is like, I'm thinking retrospect, I mean, okay, I liked physiology when I was in medical school, somehow. I don't know why, that was my favorite topic. But so, and nephrology is a lot about physiology, basic science, basic understanding of the human body, and that you have to do that every single day to be able to practice properly. So that's one thing. And then the other thing is, I liked the comprehensive nature of kidneys, comprehensive nature of the nephrology. Kidneys are very smart organ, but they're also very sensitive. They get affected by everything else which is going on in the body. Every organ can affect the kidneys. Every medication that you're taking can affect the kidneys. Literally, it's like pretty much everything can. So when we are practicing nephrology, we have to look at everything. I'm not just looking at patients' kidneys. I'm looking at what all is going on with the patient. So that I like that. I like the comprehensive nature. I get a better idea about the patients. I want to know everything about them to be able to determine, okay, what's causing their problems with the kidneys. So I like that aspect quite a lot as well.
Does that mean you have patients who say to you, well, I think it's this, and there's that explanation to them, well, yes, this, is related. This can cause the issues with
Yes.
your kidneys.
Yes, yes, yes. So we have to look at the whole picture, and like most commonly, diabetes, high blood pressure, being overweight, smoking. These are the major problems, which are in general a major problem in our healthcare system anyways. So these are the ones which
Well, I
definitely.
was gonna say, so when somebody is being told by their doctor hypertension is an issue,
Yep.
and they think, okay, that's just high blood pressure, I need to worry about that. They're not necessarily thinking, oh, that's affecting kidneys.
Down the line,
Yeah.
it can start affecting the different organs of the body, and kidney is one of them. So yeah, when you have diabetes, it's just not, because these diseases are systemic diseases. You have diabetes, you have high blood pressure. If you don't take care of those properly, then over the down the line, they can start affecting every single organ of the body, and kidneys are right up there, which gets affected pretty bad with these diseases.
You know what I like? March is National Kidney Month.
Yes, it is a National Kidney
think
Month.
we all learned
and
that.
Yesterday was National Kidney Day. Yeah, so perfect timing for this.
Yeah, absolutely. So tell us, when should somebody see their doctor? What you mentioned, they might be experiencing something, but maybe not realizing it is affecting kidneys.
That is actually a very, very good question and very important question to understand. The biggest problem with the kidney disease is it sneaks up on you, because kidney disease does not give any symptom whatsoever until you have actually pretty advanced kidney disease.
Wow.
Yes. So the question is, how do we identify? So the burden of kidney disease is pretty heavy in United States. Probably around 35 million people are affected by that. Every one of the 3 adults will be affected by that. So it's very important to diagnose the kidney disease. If you have risk factors like diabetes, high blood pressure, smoking history, being overweight, then you should get blood work pretty frequently, every 6 months, every year from your doctor, to identify that you're not starting to develop kidney disease. Otherwise, if you don't, and the family history as well is very important. If you have a family history of kidney disease, then that should be screened as well. So apart from screening, there is no other blood work screening. There is no other way. It does not give you any symptoms until you have very advanced kidney disease. And that's when you start to get symptoms related to the kidney failure, but it comes pretty late in the disease process.
So the recommendation is to start early and just
Start early
testing
screening,
and screening.
especially if you have risk factors. Start early in the screening process. If there is a signs of damage to the kidneys, then the patient should come and see us. And then our goal is always to try to minimize the risk factors to decrease the progression of the kidney disease, because once the kidneys fail, yes, we have dialysis and transplant options, but life is very difficult in those scenarios.
At what point does a patient see you? Is it after they've been to their primary care physician,
Yeah.
and they get recommended to you, or how does that work?
Yes, that's exactly how it works. Primary care physician or maybe some other specialty doctors can identify that the patient is starting to develop kidney disease. And the spectrum is quite a lot. It depends on a lot of things. When exactly is the time? It depends on the primary care physicians identifying the disease. If they have an explanation, they're going to work on that. If things still don't go in the right direction, then they come to us. But there are certain diseases which are native to the kidneys. In spite of not having any diabetes, high blood pressure, nothing, you can still develop pretty bad kidney diseases. Those are the ones which needs prompt referral. In those cases, they need to come and see us right away. So it depends on what kind of kidney disease the patient is developing. That determines, but we always say earlier the better.
It's funny because as you say that, you think, okay, Northwest Pennsylvania, people here tend to work hard, play hard,
Yes.
and it's not really an emergency until it is an emergency. So what's your message to somebody who is just sitting there and they know, maybe they haven't been to the doctor in a few years, and maybe since COVID they haven't been to a doctor.
Yes.
What do you say to those folks who are thinking, yeah, you know what, I probably should go and see my doctor?
Yes. Yes, I think yearly checkups at the least should be a must for every single individual. Because of exactly this reason which we talked about, you sometimes won't even know that you're developing a disease process until you have the blood work done or a routine health physical examination done. And primary care physicians are the single most important doctors in our healthcare system. because they are the gatekeepers. They are the one who are going to identify them. And if we don't go and see them on a regular basis, then they will not be able to do that. So I would say, at least, even if you think you're a healthy individual, at least a yearly physical and routine blood work with your primary care physician is extremely important.
And if something comes up, you mentioned some of the big factors, hypertension, diabetes, but there's some other signs for kidney disease. So if something's happening to you that is unusual, probably another sign that you should probably go to the doctor.
So with advanced kidney diseases, the most common symptoms are what happens the first is you start retaining fluids in the body. So your weight will start going up pretty quickly, your feet might start swelling up, you might start getting short of breath and feel swollen everywhere in the body. These are signs of fluid retention which can happen when you have bad kidney disease or heart disease or liver disease. So these are the things which should very quickly, promptly should be signed for going and seeing a physician. Otherwise, the other symptoms are usually very non-specific. You just feel very tired, sleepy all the time, just no energy to do anything, no appetite. The food doesn't taste good, metallic taste in the mouth. So these are the signs of very advanced kidney failure. And if any of these are happening, then definitely yes, should be seen by a physician.
And you should always play it safe. It could be something, it could be nothing.
Could be nothing, but yeah, definitely getting checked out. There are some urinary symptoms also which patients can have. They will notice decreased urination. Obviously, there's sometimes that you can have a frothy urine. I don't like to mention it because sometimes it can, cause concern in the patients because it's not a very specific sign and a symptom. But if you are seeing a very, very frothy urine, that's also a matter of could be a matter of concern. And blood in the urine is also sometimes which you need to be very careful about. If you're having a cola-colored urine, blood in the urine, those are also some of the symptoms that needs to be. If you're noticing any of that, then seek the medical attention right away.
What about another thing you hear a lot about, kidney stones?
Yeah. Kidney stone is a very difficult problem to deal with for the patients who are dealing with it and also to manage. Kidney stones, basically two major things. There are unfortunately some genetic predisposing factors. Some families have a tendency. You will see if one patient have it, most of their family member will have it, or some of their family members will have it. So there's always some genetic predisposition, and then on top of it, you add some lifestyle diseases. So lifestyle is not keeping yourself well hydrated. So that's where drinking lots and lots of fluids is extremely and the single most important thing that helps with that. And then there are some dietary changes, like too much of animal meat can predispose that. Alcohol can predispose you to have kidney stones. And there are some diseases like if you have hyperparathyroidism, those diseases can do that as well. But yeah, I mean it's a tough disease. It's very, very painful, I have been told a lot of times. But yeah, there's usually some predisposing factor. So if you have a family history, then you should be extremely careful about, at the least, trying to stay very, very well hydrated to decrease your own risk of developing a kidney stone.
April's coming up, and April is Donate a Life Month.
Yes.
So talk a little bit about that side, because it can be a very emotional process.
Yes. So unfortunately, sometimes in spite of the best of the efforts, kidneys do fail. After the kidney failure, we have options. There are mainly three options. One is the conservative management. Sometimes the patient at stage of life, they don't want to undergo dialysis. They don't want to undergo transplant. We just do conservative management for those patients. The other option is to do dialysis. Dialysis is very tough. It's a life-sustaining therapy. If the kidneys are not working, then we do the dialysis. The machine does the job which the kidneys are supposed to be doing, but it is very tough on the patients. The patients go through a lot of tough time to go through dialysis. So it should not be taken lightly that, oh, if the kidneys fail, they can always do dialysis. No, the life on dialysis is very difficult for every single patient, and as a healthcare community, we also need to understand that those patients are going through really hardship to go through dialysis. And that's where the transplant part comes is in, if your kidneys fail or they are failing, we can, if you are a candidate for getting a transplant, you're healthy enough to get evaluated for transplant, we always encourage them to go and get evaluated for transplant. Transplant could be two ways. One is something called a diseased donor transplant. If somebody dies, then if they're an organ donor, then they can give kidney to somebody else. There is a very long wait list for that, approximately 4 to 5 years.
Wow.
Yes. So once you get on the transplant list, then you have to wait for about that period of time to actually be able to get the transplant. The other way to get the transplant is to get a living kidney from somebody you have. If you have a friend and a family member who is healthy enough and willing to donate you a kidney. And the good thing, which specifically I want to point out here, is if you have a family of friend who is willing to donate somebody a kidney, they actually do not need to match you.
Really?
Yes. So what happens is if they match you, that's great. You can get their kidney and get the transplant. But if they don't match you, there's a beautiful system here in the United States that all your information goes into a database, and you get matched with somebody else's kidney, and the person who's your friend ready to donate your kidney gives a kidney to somebody else.
Wow.
So it's a mix and match. So everybody's a winner. Everybody gets the appropriately matched kidney. So that's why I always try to tell people who are looking for a kidney donor is to don't worry about matching. Just make sure if somebody is healthy and willing to donate a kidney, they can get evaluated, and then everything will be taken care of after that.
Real quick, just talk about maybe some of those services that you provide, and you can go to the website and see those, but just kind of run down some of those things that people would come and see you.
Yes, so obviously the kidneys, if you have an acute kidney injury, that means if your kidneys fail suddenly, that we take care of. So the second thing is a chronic kidney disease, where you have gradual progression of your kidney disease. Nephrology, hypertension is one of the integral part. Kidneys play a very, very essential role in the blood pressure regulation of the body. When you actually develop kidney disease, you develop hypertension at the same time.
Wow.
Yes, so hypertension management is another thing, kidney stones as you mentioned. And then there are several other electrolyte disorders which a nephrologist would be managing, like low sodium issues, calcium issues, and potassium issues as well. So there are a lot of electrolyte imbalances that we take care of, and yeah, kidney stones.
How much has technology changed your field?
Technology is finally making some changes. We are getting some advances in nephrology. For a long period of time, even up to when I was getting trained, there was a lot of frustration in the nephrology field that we are not getting anything new coming out in our field that can actually help the patients. I think there are some new medications, new classes of medications that have come about, which we are trying to work with and help our patients. The transplant is another huge successful every time. So the outcomes of the transplants is getting better and better and better every year. It just with a better understanding of which medications to use after transplant and all that stuff is helping a lot as well. Talking about real in future, well, there is an artificial kidney in making. Hopefully for everyone, it's successful. Kidneys are a very complicated organ. It's very difficult to produce an artificial kidney. I get asked this question quite a lot. It is an early process, but we really hope that at some point in our lifetime that is a real option.
Well, the key is take care of yourself now.
Yes, prevention is the key, which is exactly why we talk about we don't want to go into those options. We want to do everything to prevent the kidneys. Once again, kidneys are very, we have two kidneys for a reason. It is a very essential organ. Even God thought that, listen, this is a very important organ. Life will be very difficult without it. So we got two. So we got to take care of them.
Take care of them. I'll ask, what do you do to relax? What do you do for fun?
I like to do outdoor activities a lot. Hopefully play. I've been trying to learn playing tennis recently.
Excellent.
I do play cricket, which, believe it or not, there is a huge cricket league in Pittsburgh. I go to play. So, yeah, sports is something which keeps me going for most of the times.
Was that something that was attractive to you when moving here? Just the outdoor recreational opportunities, the love of sports and
It's
the support?
it's just always there. Every kind of sports, like I like to play, and no, there's certain I can't play for sure, like basketball. Never grew up playing that in sports, so it's very difficult to learn to play something completely new. But anything, I would say anything with a ball and a bat, I can play.
Was that part of something you looked at when you chose to come here, is just the location, and you can be in Pittsburgh or Cleveland or Buffalo. We have these great outdoor recreational opportunities.
Yeah, I think, I mean, coming here happened, I have a very good friend here who was already working here, and I got really good recommendations about the place, and I came and visited the place. It had just a very warm feeling, and that feeling has always been there I feel like I made the really good decision of coming here. I don't like city life. I don't like the hectic life. This is nice and relaxed, where you can really work hard, do your job, and still have time to relax and enjoy.
And it also sounds like you can make a difference.
You can make a difference. And I really like the opportunity that that this hospital provides me to be able to spend time with the patients. Whenever somebody needs more time and attention and all that stuff, I always feel that I have time, which a lot of my colleagues and other places I have discussed with. It's not pretty much not the same everywhere. So this place provides us the opportunity, and we try to make the most of it.
Dr. Maan, it was a pleasure.
Thank you so much
Thanks for joining us.
Yeah, thank you so much for inviting me.
We'd like to thank Dr. Maan for joining us. Jackie, there's a lot going on with the hospital. What can folks expect to take part in over the next couple months?
Yes, Luke, we do have a lot going on. In March, we have Doctor's Day, which is March 30th. And then here at Meadville Medical Center, we have a Doctor of the Year. So staff have been voting on the Doctor of the Year. That will be announced that day, or maybe the next couple of days after that. Rolling right after March, we have April, which is Core Month, and we have a Core flag raising celebration here at the hospital on April the 10th. And then April the 12th, we have Blue and Green Cookie Day. So in our hospital cafeterias that day, feel free to come in and grab a blue and green cookie. Also, April is Volunteer Week, so we highlight and celebrate our volunteers and our auxiliary members during that month. And then coming up in May 4th, we have our annual stroke walk. It's at 1 Vernon Place, and the walk starts at 10. Registration is at 9:30 that morning. The walk will probably go from 10 to 10:30, 11 o'clock. We have a live broadcast from Froggy Radio there, and we have baskets, prizes people can win, 50/50s. So it's a really fun day. So if you're free that day, definitely come on out.
Well, there's a lot going on, and the best way for people to keep up to date with everything?
Our Facebook page, Meadville Medical Center Facebook page, please like and share that. And then also mmchs.org, our website.
Jackie, thank you.
Thank you.
And thanks for joining us.